Of course, this video is coming from a place of frustration, and it's directed towards the medical community. I'm sure I'm not the only one who's frustrated with the cattle call of a doctor's office these days. We're ushered in, branded, and ushered back out, and there's no time in there for you to be asking any questions. And that is just really frustrating. When I walk into a doctor's office, which is a rare moment, but when I go to a doctor's office, it's because I'm concerned about my body, my health, something that is different from what I know as my own function. So that in itself should say not normal. Not normal. And if I take the time to sit down and take notes of my thoughts, my questions, and my concerns about my health and my body, then I don't think it's unreasonable to want the 10 or 15 minutes that you allot for me, for each of your patients, to be spent answering my questions. Never mind that you got a radiology report that says unremarkable. I got that same report, but I know I have pain. And I know it's specific areas, and I know it's constant. It's there. It's not my imagination. And the last thing I want from you is some pain medication prescription. I want to know what's going on. Then we'll talk about treatment. Patients, you guys seem to have forgotten that we get to participate in our treatments, in our choice of treatments. And treatment doesn't even begin until after the question and answer phase, the information phase. So if a patient says, "Can you please go over these MRI images with me and answer my questions?" Answer their questions. When a patient says, "Please pull up this image and explain to me what that is," explain to them what that is. Don't say, "It's normal." "It's normal" is not the answer to what is that. I spent, no, let me rephrase that. Let me back that up. The neurologist spent more time trying to make me feel stupid for having questions and wanting my questions answered than it would have taken him to answer my questions. He stood there with sarcastic snarky comments such as, there's a reason people go to school for 8 years to become radiologists. Well, going to school for 8 years to become anything doesn't make you infallible. Doesn't mean that you can't make mistakes or miss something. Those things happen to everybody. To everybody. So, I went to school for 8 years. Doesn't change that I still question what I'm seeing. Good for you. You went to school so that you could answer my questions. So, there was the school. Then he decides to spend his energy, again, rather than answering my questions, saying, well, if you're going to research on the internet, why don't you look up the effects of smoking on pain? Really? Because, you know what? We had the conversation in the privacy of an exam room about my smoking, and I had already told you that I was down to half a pack a day, and I was working towards quitting. I didn't need your snarky little, we don't work on quitting, you just quit. And then, when you personally, as a medical professional, finalize a visit with looking at a patient and saying, I suggest you just stay away from doctors. Any credibility at all that you might have had just went out the window. And know, trust, believe, we talk to each other. Not only that, but now we have the glory of the internet that allows us to inform as many people as we possibly can about how you treat us when we are at your office. Somebody asks you to review an images, you don't drag them out into the front office where you have no less than 7 or 8 staff members as well as other physicians roaming about, and proceed to start talking to them like that in front of all of these other people. If you didn't have time for me, then you should have sent me to somebody else. You should have sent me to somebody else. As far as I'm concerned, if you looked at my MRIs before I came into your office and there was no neurological issue, then you should not have scheduled me into your office. You should have sent me to an orthopedic to look and see if there was any bone issue. As far as I'm concerned, you, medical professionals, are the ones abusing the Medicare and Medicaid insurance programs. You brought me into your office for the sole purpose of a quick in and out payment. That's insurance abuse. If there was no need for me to be in a neurologist's office, then I shouldn't have been there. Never mind, I spent 10 days waiting for that appointment, worried and concerned about what was going on with my spine, that I got referred to a neurologist instead of an orthopedic, which was where I was trying to get to begin with, because I have an old car accident. You cannot tell me that there is nothing going on in my back when I've already been down this road. You want to tell me it's arthritis? You want to tell me it's osteoporosis? You want to tell me it's degenerated discs? Tell me that. You want to tell me that there's nothing you can do about those things safely until they get to whatever extreme? Then tell me. But don't say, oh, you're fine. You've got the back of a 25-year-old. I don't have the back of a 25-year-old. First off, I was 32 when I injured my back. So, your snarky, snotty responses to your patients because you're frustrated with the medical system doesn't help it. It doesn't help it. That neurologist could have answered my questions in 5 minutes rather than have me standing out there in front of everybody where he could try to intimidate and humiliate me so that I would go away and leave him alone. That's just rude. That's just disrespectful. And I don't think because you went to college and got a degree to be a doctor gives you the right to be rude and disrespectful to anybody. If anything, the information that you have telling you as a specialist that pain causes frustration and aggravation, fear exacerbates those situations, you got no business there. No business there at all. Stop it. Stop treating patients like there's something wrong with them because you can't figure out what's going on. Stop treating them like they're imagining things because you can't figure it out. What happened to the days of doctors diagnosing? What happened to those days of a doctor saying, okay, this is very unusual. What can be doing this? What can be causing this? Because never mind my age. 57, by the way. I have no issue with that. I spent my life after the car accident doing everything I had been trained to do to take care of my spine, to keep the muscles as strong as possible so that I could live as pain-free as possible after the last injury. Now I'm babbling. Educated professionals. Educated professionals. You think that because you've gone to school that gives you the right to be rude. No. No. You went to school to give answers. You learned to have answers. Real answers. Not snarky responses.